Hello everyone, my name is Kenneth Versosa Castro and I'm a student at the Universidad Católica Santiago de Guayaquil. And today, this is Medical English and today I'm going to talk about transplanting hepatitis C positive kidneys. Definition The definition infection with the hepatitis C virus is relatively frequent after kidney transplantation 2 to 6% and have negative impact on the survival of the graft and the patients, mainly conditioned by the liver and extrahepatic disorder it generates. This liver disease represents the fourth cause of death in the population and these patients have a higher incidence of serious opportunist infections.
Study, we transplanted 10 patients with kidneys from hepatitis C positive deceased donors and treated them simultaneously with antiviral medications for hepatitis C. We had excellent transplant outcomes in these recipients and were able to prevent long-term transmission of hepatitis C from the donor to the recipient. So we were able to successfully treat all 10 recipients and prevent long-term transmission of hepatitis C from the donor to the recipient. They also had excellent outcomes following the transplant in terms of kidney function and recovery. Currently, there are about 1,000 kidneys per year in the United States that are not utilized because the donor is hepatitis C positive and there's no appropriate recipient to place them into. They're otherwise excellent kidneys, so we hope to be able to use them in recipients that already have a long wait for a kidney transplant and treat them with the antivirals that can successfully treat hepatitis C. And so long term, we hope to transplant many more patients with hepatitis C positive kidneys along with treating them for hepatitis C to have both a successful transplant outcome and also prevent transmission of hepatitis C. We hope to take the results of the expander study and apply it to other organ groups as well, especially patients waiting for heart transplants and lung transplants. Both of these populations could benefit from a shorter waiting time. And since there are organs from hepatitis C positive donors, both hearts and lungs that are currently discarded because there isn't an appropriate recipient to put them into, we hope that we can put these kinds of transplants into hepatitis C negative recipients, treat them with the antivirals for hepatitis C, and have successful outcomes.
Application in medicine. Kidney transplant and considered the best treatment option for patients with kidney failure. If you decided that you want a kidney transplant, you should be examined at the transplant center to see if you are ready for transplant surgery. This evaluation examines your psychological health, mental health, and financial situations. This is very important. Pros and cons. The risk of acute rejection in patients is controversial. This modification may explain decreased incidence of acute rejections that has been described by some authors. The pain the patient the patient has a higher incidence of postoperatory infection and serious infection of the central nervous system and lungs.
One day I was at work and my cell phone rang and I answered the phone and David Goldberg from UPenn was on the other side of the line.
I did get a call from Dr. Goldberg. The funny thing is, at first I thought it was like a prank call. I got on the transplant list in October 2014.
The doctors also said that if I were to find a donor and go for kidney transplant prior to dialysis, that would be the ideal situation.
I think because of my blood type, I wasn't going to see a transplant for 5+ years.
What we learned is that there are hundreds of kidneys from people with hepatitis C that are donated, but they're never used. They're literally discarded. So this study brings those kidneys to people who need it. We're doing transplants that were never done before. We're giving people hepatitis C with a transplant and then trying to cure them afterwards. So we chose people who had many years of waiting time ahead, people who were already on dialysis. And then the third piece of it is that we were really insistent on choosing people who could go through an intense informed consent process.
So once I got the material, I just read through it. I gave it to my son, my daughter, my friend, my sister, so they can all read it, so I can get their impression, their thoughts on it.
So the theory is that if I were to receive a Hep C kidney and develop Hep C myself, then they have a plan to treat me with Zepatier and be able to cure my disease.
People have to opt in to get a hepatitis C positive kidney. And so what happened at our center was that we brought these people in for multiple visits with a lot of education. After all of that and an extensive informed consent process, then we could check the box and they could get those offers.
My son looked at me and said, "Mom, this is a no-brainer," very clear. My daughter said the same thing.
When I first enrolled and they told me that the transplant would be quick, I was actually hoping that he'll just say maybe a year or 2 years. To my surprise, he said it'll be a few weeks to a few months.
Performing transplants is really just a wonderful opportunity to improve people's lives. We take care of individuals who come to us who are incredibly sick, whose lives have been devastated by end organ disease. In particular, patients with end-stage renal disease on dialysis usually can't work. It's a large burden on their families, and so the opportunity to perform a transplant successfully is incredibly meaningful because you can turn around someone's life.
When patients get transplanted, we're checking their blood to see if they have detectable hepatitis C on post-transplant day 2 or 3. One of the unknowns is, will every patient develop hepatitis C?
So I did get the disease. They told me this the day after surgery, and they started me on the medication. That Friday, it went down dramatically. I couldn't believe it. And the following week, it was completely gone.
So once they have detectable hepatitis C in their blood, we're treating them with a medication called Zepatier, which is 1 pill a day for 3 to 4 months. That is along with all of their standard post-transplant medications, which are not altered in any way. Among the general population, Zepatier cures more than 95% of people with chronic hepatitis C.
We estimate that there will be somewhere between 400 to 1,000 additional kidney transplants from hepatitis C positive donors if this trial is successful.
I'm looking forward to traveling with my grandkids, spending more time with the kids, go back to the things that I enjoy doing.
And she was just so excited about that simple pleasure that we all take for granted, and it was so gratifying to hear that.
Now that I have energy, I can all be picking up playing tabla, the Indian drums again. I'm also a gym rat. I go to gym every day. I want to get back into that routine. So now I'm feeling confident after the transplant surgery that I'll be able to do all that.
What's been really gratifying is that with Irma and some of our earliest experiences, that they've responded to therapy right away.
They've given me my life back.
All these doctors and plus the nurses, they were phenomenal. They changed my life.
Conclusion. Infection with the hepatitis virus is considered a factor that reduces the survival of the patient and the graft and a kidney transplant. The new direct-acting antivirals are very effective and have an excellent safety profile, allowing the virus by eradicate from the patient with kidneys disease. And this represents a revolutionary radical change in the natural course of these infections, until now without effective treatment. That's all for today. Thank you very much.